This is Module 1, Communication and Communication Disorders. In this module, we will talk about communication as a whole, define it, and talk about disorders that are associated with communication. We will also talk about the professionals who treat individuals with communication disorders, such as speech-language pathologists and audiologists. I encourage you to read Chapter 1 in your book, answer any questions that are presented at each section, and also take notes as you follow along in this PowerPoint. What is communication? Communication is a process by which information is exchanged between individuals, and they're exchanging this information through a common system, whether they're using symbols, such as letters or emojis, or they could be using signs, such as gestures or sign language, or even behavior, such as facial expressions or tone of voice. Not only is it important to think about what we are communicating, but it's also important to think about how we are communicating. Think about in a 24-hour period how much you're communicating. Do you use verbalizations? Do you talk to people? But what else do you do? Do you use facial expressions to show sadness or happiness? Do you cry? Do you smile? Do you laugh? Do you use gestures to say hello or goodbye or even leave me alone? Do you use body language to say I don't care or go away? Do you use reading and writing? Do you text? Do you send emojis? Do you post on Facebook? How are we communicating? It's far more than you think. I want you to listen to the following message. 1, 2, 3, 4, 5. 6, 7, 8, 9, 10. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. As you can see from the previous message, my words did not have meaning, but the way I said my words did have meaning. You could tell whether I was sad or tired or excited or scared, and a variety of other emotions. I would like for you to take a minute and journal about your communication. How do you communicate on a daily basis? What are you doing to communicate? What's the message you're trying to send? How do other people communicate with you, and what message are they trying to send? Hopefully you journaled as previously instructed on communication and what it means to you in your daily life, and how others communicate with you. Upon completing this exercise, hopefully you're able to understand how important communication really is and how much we really do communicate. In your lifetime, you probably have come across someone who is not able to communicate very well. Maybe they have an articulation impairment and they can't say their sounds, or they have a language impairment such as aphasia and they can't remember their words. Or maybe they have a fluency disorder and the words don't come out like they want them to. Or maybe there's a voice disorder and their voice sounds hoarse or breathy. Maybe they're deaf and hard of hearing and they can only use sign language and they can't use words. Communication is so important because it's our way of expressing ourselves to others. When we have a disorder in our communication, we often need a specialist to help us become better communicators. One individual who works with communication disorders is the speech-language pathologist. The speech-language pathologist is a trained, licensed, certified individual who can treat, diagnose, and help prevent communication disorders. The training takes place in graduate school after one receives their undergraduate degree. There are 36 hours of graduate work and 400 clinical clock hours that must be attained. 25 of those hours can be observation, but 375 have to be direct clinical contact where the graduate student is actually working with patients and clients under supervision. Once the speech-language pathologist completes the graduate work and the clock hours, they are eligible to take the national exam. The national exam is authorized by ASHA, the American Speech-Language Hearing Association, who also is our certifying body. Once the individual passes the exam, they are then able to complete their clinical fellowship. The clinical fellowship is the SLP's first job. However, this first job must be under an ASHA certified mentor. This fellowship takes place for 36 weeks full-time work. Another name for ASHA certification is the CCC, or Certificate of Clinical Competence. After the speech-language pathology graduate student completes their graduate work, takes the national exam, completes their clinical fellowship, they are then eligible for the CCC, or Certificate of Clinical Competence. Remember, speech-language pathologists must maintain ASHA certification and state licensure while they are practicing. Every state requires a license, so no matter what state you live in, you must obtain a license within that state, while also maintaining your ASHA CCC, or certification. There are several settings that a speech-language pathologist might work in. Among those are hospitals, long-term care facilities, home health settings, university clinics, residential facilities, educational settings, and private practice. In a hospital, a speech-language pathologist might be in the acute care setting. Acute care is usually where patients are right after they've had a stroke or TBI. The speech-language pathologist works with the occupational therapist, physical therapist, and medical doctors to determine the best needs for the patient. Usually the speech-language pathologist is determining if there is language impairment or any feeding or swallowing issues. Also within the hospital is the inpatient and outpatient rehab. Here, the speech-language pathologist also usually works with a multidisciplinary team, including occupational therapists, physical therapists, social workers, or anyone else who needs to be a part of the patient's rehabilitation. In the NICU, the speech-language pathologist will work with the neonatal intensive care specialist to determine if there are any feeding and swallowing needs for the infants. In long-term care facilities, speech-language pathologists work with the nursing staff and doctors and also occupational therapists and physical therapists to determine the best needs for the clients who live there. In these skilled nursing facilities, usually you're working with language and speech disorders and feeding disorders. Rehabilitation facilities are also considered long-term care facilities where one might stay for several weeks or months rehabilitating from a stroke or traumatic brain injury. A home health setting is a place where speech-language pathologists may work on communication disorders or feeding and swallowing disorders of birth to 3, which is early intervention, and then also with adults, depending on who needs the treatment. The university setting is a place where speech-language pathologists also work. They can supervise graduate students, treat clients themselves, they can work on a PhD, and all participate in research. Residential facilities are usually places for adults who have intellectual disabilities and reside there. Speech-language pathologists also work on a team here to determine the best needs for these clients. An educational setting is a popular setting for speech-language pathologists. This can include private schools or public schools. In the educational setting, the speech-language pathologist has to determine if the communication disorder impacts educational performance. The speech-language pathologist works with teachers, special educators, principals, parents, nurses, social workers, occupational therapists, physical therapists on a multidisciplinary team to determine the best needs for the client student in an educational setting. A private practice is a place for speech-language pathologists to treat patients, clients individually and privately. The speech-language pathologist can either go into the home or they can have the client come into their private practice. Other professionals who are trained, licensed, and certified to work with individuals who have communication disorders are audiologists. Audiologists are specialists who are trained in non-medical treatment of hearing, balance, and other related ear problems. Audiologists use special equipment to evaluate individuals who have symptoms of hearing loss, balance disorders, and other auditory problems. Training for audiologists includes 75 hours of graduate work. They can obtain their AUD, which is their doctorate in audiology, or a PhD or an EdD, which is the doctorate in education or doctorate in philosophy. In addition to the training, audiologists must have a supervised clinical practicum of 52 weeks of 35 hours per week, and they must pass their national exam by ASHA, the American Speech-Language Hearing Association. Once audiologists complete their training, pass their exam, and complete their practicum experience, they then can receive their CCC, or Certificate of Clinical Competence, from ASHA. They also receive their state licensure in whatever state that they are working in. Audiologists can work in hospitals, ENT clinics, university clinics, outpatient clinics, hearing aid manufacturers, and can also participate in research. Audiologists work in a lot of similar settings as speech-language pathologists. However, there are some settings that are different, such as the ENT clinics and hearing aid manufacturers. I encourage you to go to www.asha.org and peruse the website. ASHA, the American Speech-Language Hearing Association, is our governing body. They issue certification for speech-language pathologists and audiologists. That certification, again, is called the Certificate of Clinical Competence, or the CCC. ASHA also issues our Code of Ethics, which we must practice under, and tells us what our scope of practice is. There are over 140,000 members. I have included links and copies of the scope of practice and the Code of Ethics in this module. I encourage you to read both documents as well as peruse the ASHA website. Information on your quizzes, midterm, and final will come from PowerPoints, chapters in the books, and documents that I post in the modules.